This is Nurse Carrie with Home Instead Senior Care. Today I have our mock patient Gina, and I'm going to be talking about dehydration facts, tips to stay healthy and well, and a simple test you can do to see if there's signs and symptoms of dehydration. So how are you doing today, Gina?
Well, I feel okay, except I felt a little dizzy today, and I noticed that my mouth is dry, like I'm thirsty.
Okay.
I can't get enough to drink.
So with the holidays, did you maybe have some Chex Mix and some other really salty foods?
Well, it is the holidays, and I simply can't resist anything. So I may have had a little more salt intake than usual.
Okay, all right, that is quite common. So now we have to be cautious because Gina would be a fall risk, as your client would at home, because when you have too much salt, things change or happen in your body. So typically there is a balance between the salt and water proportion inside your cells, the fluid around your cells, and the fluid in your blood. So when you have too many like high salt foods or drinks, your cells actually get very low on salt, and the fluid around the cells gets very concentrated in salt. So this makes you dizzy. It can make your blood pressure go up initially, then go lower. You can get swelling in your ankles from the extra fluids.
I definitely have
May I take a look at your?
Absolutely.
Okay. Oh yes, there's definitely some swelling. So I'm checking for edema, and I can leave little imprints. So this would be mild pitting edema. Okay, so then elevating your legs in the chair. Okay, so we'll try that.
Oh, that feels nice.
Good. And then we want to drink more water, not coffee, not tea, not, what else? Juice is okay, but there's a lot of sugar. So strictly water, so that you can get that balance back between the fluid, the salt fluid, the combination inside your cells, and the salt fluid combination in the fluid around your cells and also in your blood. There is a test if you're, simple test. It's called a tenting test, like an inchworm, like a tent. So in an older adult, we need to do this on their forehead. Younger, like little kids, we can check that more on their chest. Because older adults, from the sun, they may have more wrinkled, like aged skin, wrinkled. They may be less hydrated there. So then, is it okay if I go ahead and gently?
Sure.
Okay. So I'm just going to check on her forehead and letting her know what I'm doing. And it's going right back in place. If I did this and it stayed pinched up kind of like this and took a while before it went back down, that would be tenting. So it is a symptom of dehydration where you definitely want to call your doctor. Do you have any other updates for me, Gina?
No, except I know that you've mentioned that I need to drink more water.
Yes.
How much water should I be drinking on a normal day?
As long as you don't have any kidney problems, and you're not on dialysis, then the goal is 64 ounces a day.
Okay, good to know.
And not all in the morning and then stop, not all in the night at evening and stop. About a glass every couple hours throughout the entire day, which is really good for you. Because literally your kidneys live for water. That's their job, is to filter water. So again, as long as you're not on dialysis, don't have kidney issues, they recommend that amount of water. If you do have a chronic condition, you may have your fluids limited where you cannot drink that many ounces of water per day.
Very good.
All right, well, thank you, Gina. It was so
You're
nice seeing you
welcome.
again.
Thank you, Nurse Carrie.